Hi there, my name is Josh and I'm currently taking a degree of Bachelor's of Imaging. The case study that I will be sharing with you today will be on Betty Raven. Now, Betty Raven is 68 years old and has been married to Brian Raven for 44 years. They have 2 sons and 5 grandchildren. Betty has never smoked a cigarette before, however she suffers from secondhand smoking. Now, she has constantly urged her husband to stop, but it has been to no avail. So Betty has a family history of a heart attack, and this is from her father's side, who suffered from a stroke and died at the age of 77. This could be one of the reasons that she might have suffered a heart attack. Now, a heart attack occurs when an artery pumping blood into the heart gets choked, therefore interrupting the oxygen supply to the heart, which causes a heart attack. Now, if the heart stays without oxygen being pumped into it, the heart will eventually die. Betty has recently suffered from a heart attack while she was walking down the stairs of her apartment. Her husband called the paramedics and informed them that it was a heart attack, as he was able to see signs of it through his wife's response. Now, Betty complained that she felt pain in her chest as she was sitting on the stairs. Brian noticed that she was out of breath, as she was finding it very hard to explain the pain she was going through, and she was only able to speak in short sentences. Now, as Brian called for the paramedics, he noticed that because she was out of breath, she looked rather purple and faintish looking. These were all classic signs of a person suffering from a heart attack: discomfort in the chest, shortness of breath, and lightheadedness. Now, when Betty arrives at the hospital, she will first have to see a GP, depending on how serious her condition is and the time of day she gets to the hospital. The GP would see Betty and give a quick diagnosis to see if there's any immediate danger, after which she would be referred to a specialist who would be better to assess Betty's situation. Now, the specialist Betty would see would be a cardiologist. A cardiologist specializes in the areas of the heart. He would have a more detailed diagnosis by sending her off for different tests before deciding what the next best possible solution would be. Tests such as X-ray scans or CT scans will be performed by a radiologist to see if the arteries are blocked and if there's a need for surgery. Now, during post-surgery, if there is one, the cardiologist may send Betty for physiotherapy. Betty would undergo breathing techniques and light exercises to help rehabilitate her heart in order for her to continue her daily routine. Now, this routine of exercise and breathing techniques will be facilitated by a physiotherapist. In conclusion, Betty, who's had a family history of heart problems and the years of secondhand smoking, has contributed to a heart attack. She showed common signs of symptoms of heart attack and therefore was rushed to the hospital. She was taken through procedures that a heart attack patient would have followed. A GP would see her, after which she was referred to a specialist, a cardiologist. A radiologist would then test to confirm the diagnosis of a heart attack. After having a surgery being done, Betty would have been sent to rehab, which was done by a physiotherapist to help her transit back to her daily routines. Thank you very much.